All right, so you've done your screening and now it's time for interventions. If in your screen you noticed a dysfunction in saccades, then we want to work on that. So a saccade is those eye jumps that you see when you look from object to object. It's your eyes teaming together to bring something of interest into focus. Symptoms patients might complain of that are associated with saccadic dysfunction are slowed processing, slowed reactions, brain fog, fatigue. We see a lot of patients with that, so hopefully working on these can help some of those symptoms. Specifically, for this intervention, you want to make sure the patient's head is still because you want the eyes to be doing the work. So to cue them to keep their head still, one example of an intervention is saccade strips. It's like the most basic intervention that you can do. I'll show you what that is on the next slide. There's also field scanning, which is grading up saccade, making it more difficult. So that involves the environment. Again, I'll show you what that is. And then I want to introduce the Brock string now, and I'll go over it more again later. But the Brock string, for those who don't know, it's a string that has three beads of different colors on the string. You can use this for saccades by holding the string horizontally in front of the patient's eyes, and they can jump their eyes from bead to bead, and you can cue them what color bead you want them to look at. Okay, so saccade strips are on the right here. That's that most basic saccade task that you could do. It's basic because it's basic, haha, because these are like uniform, they're structured, they're in the same pattern. You just go left to right, top to bottom. But you can grade this task up by incorporating other elements of like the body. For example, you could in this picture on the left, you could incorporate colors, near far blocks, have them cross midline, do functional reaching. Um, you could put weights on their hands to like add some strengthening task. And then if you go to the next slide, if you wanted to just focus on the saccade task and not incorporate like the body to make the task harder, you can do field scanning, which is where you have a less uniform pattern. It's more random distribution of objects you're looking for. This can be like this paper here, where the patient keeps their head still and you'll call out the letters you want them to look at. So G, O, D, they'll try to find it. You could have them point to it, or you could have them look in the environment around them, which also incorporates like a spatial image, which is more functional. Um, so have them look like I spy into the environment and look for the TV. Now look here, etc. Next slide. A more fun task is the clock task. You guys might have seen this before, where you put post-it notes oriented in a circle, numbered 1 through 12, just like a clock. And you'll have the patient, you'll call out a number, and then the patient will tap the number that you're calling out. You could also orient these post-it notes on the floor to make it more of like a dynamic balance task. And I wanted to take a second to plug this app created by an OT. It's called Clock Yourself. It's really well received by patients. It incorporates cognition and balance. And it's the same idea. You as the app will call out a number for the patient, but you set the duration of the task, the speed of the call outs. And there are different, I think, ways that you can grade up this task, but it's not free. It's $3 on the App Store. I think Frank and Diana were thinking about getting it on the OT app, so we can see if they want to do that. But that's out there. Okay, moving on. So tracking is another intervention that we can work on. If in your screen you see patients having jerky tracking, which tracking is smooth pursuits. It's your eyes keeping an object as it moves through the environment. Um, to work on this, you again want to have the patient keep their head still, so their eyes are doing the work. There are some examples listed here. You could have them pop bubbles or follow bubbles with their eyes, do balloon volleyball where you toss it back and forth. Granted, their head might not be able to stay still for that one. Do your best. On acute care, it might be more accessible to do flashlight tag, which is you have the flashlight, you shine it on the wall, and you have the patient follow the light with their eyes. And you would darken the room for that. If you don't have any of these resources, you can keep it simple. Put a dot on a note card, on a spoon, have them follow it with their eyes. You could have them use their thumb and follow their thumb in front of them. Now, these are all just kind of like just focused on tracking. But if you want to make this functional and incorporate ADLs, you could do like self-feeding where they pour water and they watch as the pitcher comes towards the cup and then pours the water. You could have them watch the food as it comes to their mouth. You could have in oral hygiene, you could have them watch as they put the toothpaste on the brush. So different functional ways to incorporate tracking. Next slide. To work on convergence and divergence, which is convergence is where your eyes rotate together to bring an object into near focus. And then divergence is where your eyes rotate outward to look at something in the distance. Um, I thought this was interesting, but your pupils get smaller when you're accommodating and looking at something close up, and they dilate when you look at something far away. So you can kind of see if that's happening to make sure there isn't a dysfunction in this as well. Symptoms patients might complain of if they have a dysfunction in this are headaches, eye strain, fatigue, blurred vision, watery eyes, double vision. So again, working on this might help some of those symptoms alleviate so then they can engage more in ADLs and whatever other interventions you want to do. Okay, to work on this, we're going back to the Brock string, which we see in this picture on the right here. The Brock string in this instance, you want to hold 1 point at the nose and 1 point far away, and you have their eyes jump from bead to bead, far away, close up, however you want to call it out. And as seen in this picture, the bead that you focus on, there should just be one of them, and then two of the other beads that are not being fixated on. So this first picture, you're looking at the closest. The middle one is the one you're looking at the bead in the middle, the green bead. And then the far right one, you're looking at the yellow far bead. Other interventions you could do, you could have a cup and you'll kind of sit in front of the patient and move the cup around close and far away, and you'll have them place objects into the cup while looking at the cup. So their eyes are converging and diverging. You can have them again watch food as it comes to their mouth so that their eyes are focusing as it comes close from far away. You could do a tray table organization task where you put a bunch of objects on the tray table and you have them reach for far away and then they organize it and bring it closer, or however you want to have them reach far, look at the object and bring it close. Next slide. Visual fields. If there's a visual field cut, there are two approaches that we can take. More commonly, OTs work on compensatory strategies, but we can actually rehab visual fields. There's a intervention called border stimulation, which is what's pictured here on the right. For this, you have the patient focus and keep their focus on, for her, it's this black strip that you see in the center. You can put a post-it card or whatever you want to do, but have them look at that card while focusing, and then in their peripheral, they'll touch the dots that they see as far as they can before the visual field cut takes out the rest of the dots. This actually shows you can get up to 5% of your visual field back optimistically. But yeah, you can rehab that. But more commonly, we do compensatory strategies. We teach people the lighthouse technique to move your head like a lighthouse to look into the visual field that's cut. You can do saccades into the visual field and have them look, 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 look. You can have them work on this more close up, like with the saccade strips, and look into the visual field that's missing. Or you could have them do this when you're like out in the hallway and play I Spy, where you have them do saccades or head turns to look at objects in that missing visual field. You could also do word searches, which is another good opportunity to teach them the anchor point strategy, where you put like a bright strip of tape on the side where the visual field is so that they can scan, find where they need to start or find where they need to stop when they're reading or scanning, so that they know then to start over and scan to that anchor point. Next slide. So when we were creating this, there were actually a lot of resources already available on SharePoint that I just wanted to bring to your attention. Frank has created treatment ideas for for OTs in acute care. There's info on what neglect versus a field cut is. There's a handout for patients living with homonymous hemianopsia. There's a bunch of different exercises for vision already up. So please, I encourage you to go look and see if you can learn something because I did. Okay, on to Lauren's slides. If I can stop the recording.